World Population Day is an annual event observed on July 11 every year to raise awareness on various population issues. The theme of this year's commemoration is Rights and Choices Are the Answer, whether baby boom or bust. The solution to shifting fertility rates lies in prioritizing the reproductive health and rights of all people. Quite a mouthful, but loaded with significance. And to make sense of it all, we are now being joined from Arise Abuja studios by Dr. Eyitayo Oyetunji. He's the Federal Commissioner representing Oyo State in the National Population Commission and Chairman, Population Management Committee at the Commission. Welcome to the program. Thank you so much for joining us.
Yeah, good afternoon. Thank you very much for making me to be a part of this very important program.
Great. Well, I think a good place to start would be to explore the theme for this year. In some other places, they've put it simply to look at the impact of COVID-19 on fertility. Can you tell us how has the pandemic impacted fertility in Nigeria? I think that's a place to start.
Yes, the pandemic has affected fertility in Nigeria in various ways. The most impactful period, of course, was at the peak of the pandemic when there was total lockdown. And first was that there were disruptions in terms of health in general, but particularly provisions and services in reproductive health, where hitherto we were battling even then with making available commodities for family planning. The pandemic virtually halted this process. And to worsen the situation, if you like, couples had to stay home for most of this period, and with the possibility of increased sexual and reproductive activities. That, coupled with the absence of ready accessibility to services in reproductive health, especially in availability of commodities, had impact. There were some other indirect impacts, especially as it affected the women and the girl child. There were increases in violence, as I'm sure you will remember there were at that time. And there still are violent incidents that have increased as a result of the pandemic. Violence against women and girls, especially rape that we have witnessed, has been on the increase. In addition, there were disruptions of economic activity. And you know that majority of the women are in the informal sector. And this meant that their activities were most affected because of the informal nature of the commercial activities that most of our women were involved in.
Okay, I know you've mentioned a number of associated issues with regards to COVID-19, but one of the issues you did mention was more procreation. So it's fair to say that we might be seeing a COVID baby boom right about now. But and also, I think it's fair to say that World Population Day, one of the areas you tend to emphasize is overpopulation and how to stem that tide. But could I just find out from you, is overpopulation really the issue, or is it more the lack of an ability to equip that population to make them more productive for the future?
Precisely. The theme of the year, which is the answer lies, the issue is not baby bust or boom, but the answer lies more in prioritizing reproductive health and rights issues. It's saying exactly what you just said, that we should not focus too much on the large population. A big population in itself is not a problem. For us, what we are worried about is when the rapidity of increase is too fast. It makes it difficult to plan, it makes it difficult to make provision. But the theme for this year is saying, instead of worrying and focusing more on the size of the population, we should prioritize and refocus attention on the reproductive health needs and the choices of women and girls. A population that is well managed, a population that is appropriately invested in, is not necessarily a liability. And that's the focus. We should make sure that those things that will empower women and girls to make the right choices, to make informed choices, to have access to reproductive health, and to have access to those things that will give them quality life, to have access, for example, to education, for our girls to be able to stay longer in school, early in school, and to stay longer, which means automatically they will marry later, and they will be better educated to bring up children, to space the children, and so on. These are issues that we should refocus our attention on. I think that's what this year's theme is redirecting our minds to focus on.
And while we prioritize the reproductive health and rights of all people, especially women and girls, are we having the right conversation, or is this, in your opinion, one-sided? What's the role of the men in this conversation? Have we brought them to the table to have this conversation so that the burden is not carried by the women and girls alone, but the men also sharing this? And let me just ask you, because you're from the National Census Population Commission, it's well over 10 years since the last population census in Nigeria. We're overly due for another one. What seems to be the problem? And do we truly know how many we are in Nigeria?
Well, you have actually loaded that question. Let's start from where you started from. When you look at the theme, towards the end of the theme, it says prioritizing the reproductive health and rights of all people. It wasn't just limited to women and girls. And that means, like you said, men too are included. As you have rightly noted, men have an important role to play. In many instances, women are hindered from, in some parts of the country and in some cultures, for example, women are hindered from accessing reproductive health services because their, excuse me, their husbands must give approval before they can have access. And also, as we focus on the girl child, a lot of attention is now being generated that we should also focus on the boy child. A lot of the violence that we are witnessing are actually from the men and not from the women. So I quite agree with you. And that's why the theme is not on just women and girls, but it says all people. Now you ask questions about the census. You're quite right. The last census was in 2006, and we shall have had another one within a decade by 2016. The National Population Commission, one of our core mandates is to collect information on the population, to collect data on the population. We recognize this as being very important, even for the realization of the theme. For you to have adequate services, to have effective delivery, you must have information on the population. You must know where the people are, what are the needs, where are the women, where are the girls, where are the men, how many are they, what are the needs. So I do agree with you that information data is critical for effective service delivery, for monitoring of programming, and also for evaluating the impact of these programs. We at the National Population Commission, we are always ready. We've been ready to conduct the next census since it became due in 2016. And we have received the support that we require from government to start those preparations. As I speak with you, a major preparatory activity for any census is the enumeration area demarcation. And we have been doing that. Out of the 774 local governments in the country, as I speak with you, we have successfully demarcated 630 of the local governments. This is a major milestone towards preparing for the census. In addition, we have prepared the estimates, the budget estimates for the census. We have worked out the timelines, and we have presented all of this to government. And I'm sure that as soon as government evaluates the situation, I'm sure the president will give the nod for the census to be conducted in due course.
Dr. Oyetunji, I just want to ask, and if you can say this in less than a minute, I listened to a radio program where they were focusing on breaking down the data with regards to population down to a subnational level, and they pointed at Kaduna as having the highest productivity in terms of population, where women on average are having 6+ children each. And then you then combine that with polygamy, which then makes, per man, you can have as many as 28 children on average. Does having that kind of a conversation, it would seem to be a difficult conversation to have. Is it something we're doing effectively? Are we likely to see changes in the law as regards this kind of a conversation, for example, underage and forced marriage?
Well, let's start backwards. The thing we don't want to do is legislation. Everyone should have a choice to decide, every woman should have a choice to decide how many children she wants, when she wants to have it, at what space she wants to have it. It should not be legislative. We've seen around the world, those countries that have made legislations against this are reversing themselves. Rather, we want to encourage women and men to have informed choices, to know the implications of whatever choices they made. As for data from Kaduna or any other part of this country, until we do a census that can give us actual figures, whatever figures that are being bandied are estimates. Yes, at the National Population Commission, one of the surveys we conduct is the National Demographic Health Survey.
Dr. Eyitayo, sorry, I'm going to have to cut you off there. I know I would have loved to hear more. Thank you for the time you gave us on Newsday.